In this video, I'll talk about my healthcare experiences in Japan. I'll discuss my visits, injuries, costs, and wait times for surgery. Also quality of service with my opinions. There are chapters for this video in the description. I'm a veteran of the Japanese healthcare system, painfully so. Like the rest of the world except War America, Japan has single-payer, universal healthcare with very good health outcomes. For this national insurance scheme, which everyone defaults into from birth, the copay is 30%. But prices are set by the government, not by corporations. That means everything is stupid cheap to begin with. Your monthly payment is based on your income. You can't lose healthcare coverage in Japan, ever. Why? You can never be uninsured in Japan. It's compulsory. It's the first thing you do when you come to Japan to live. Without a health insurance card, you can't open a bank account or get a place to live. You must show your health card first. This is why it's cheap in Japan, because everyone pays into it. There are no annual deductibles. People in Japan don't even know what that word means, deductible. There are no networks in Japan. Everyone can go everywhere, worry-free. No bills come later in Japan. All costs are known and there are no adjustments later. Everything is final when you leave the hospital, the same day. Japan also has private insurance for a bit more. I was told people opt for private insurance in Japan to offset costs of catastrophic diagnoses like cancer or other terminal illnesses. Sometimes you need a referral letter for further specialization. Referral letters cost about 3,000 yen. You can go directly to a specialist without a referral and pay about 8,000 yen extra. How much did I pay for my healthcare in Japan when I was still paying for it? For years, I made the average salary for Japan. Based on that income, I paid 8,800 yen per month. For non-emergency visits at hospitals and clinics in Japan, everyone goes in the morning. This is for urgent and non-urgent care. These are walk-ins with no appointments. It's busy. First come, first served. Doctors work through patients. This wait for me usually lasted about 1 or 2 hours because I never went early. There is a free health check every year with a comprehensive blood analysis. They also do basic measurements such as heart rate, blood pressure, and BMI. Various cancer screenings can be added for 1,000 to 2,500 yen. After age 50, cancer screenings are free. Doctors will take time to answer brief questions. If they hurry you, stay seated and slow them down. These health checks are not offered all year. There is a window doctors do these, and if you miss the scheduling period, you wait. Other insurance types offer health checks all year. I just did my health check last week. My healthcare coverage changed from the national health scheme to my wife's employer-based healthcare, so this wasn't free. It cost 3,800 yen. But it was completely comprehensive. I had the same blood work, which I'll get in about 3 weeks. I had an ECG or EKG to check my heart for arrhythmias or heart disease, eye check, a urine analysis, hearing check. Here's what I experienced with the national healthcare scheme in Japan. I tore up my shoulder and broke many ribs in a ski accident. The orthopedic surgeon at a medium-sized hospital said I can rehab it slowly, or I could opt for a more aggressive surgical path. I chose surgery. He said I could have the surgery in just 3 or 4 days. Yes, 3 or 4 days later for a non-emergency shoulder surgery. No, it was not a waiting list for months or years. It was just 3 or 4 days. I opted to have the surgery 1 week later for my schedule. The overall plan was surgery, then 5-day stay at the hospital in a private room. Yes, a private room. In America, this would have cost about 4 million yen. In Japan, it was just 450,000 yen. But what did I actually pay? My surgery cost 62,000 yen because I was not working at the time, and I got a certificate from the city for a deep discount. I paid about 2,600 yen per rehab visit after that. I also had a couple bike accidents. The first bicycle accident, I was hit from behind. This resulted in broken ribs. These were hairline fractures found on x-rays. This was an ER visit at a small hospital with an ambulance ride, then release about 2 hours later. I don't remember the cost because I didn't even check. It's so cheap. Maybe all the x-rays and the ER doctor visit was guessing 3,000 or 4,000 yen. You don't have to worry about anything in Japan. The driver's insurance paid for it anyway. Bicycle accident number 2. A car turned into me and forced me to fall on my side. This caused broken ribs and many back issues. I also broke my collarbone. This was an ambulance ride, then lots of imaging. The ER doctor at this small hospital spotted my thoracic 8 vertebrae compression. This was actually an old injury, but the doctor found it. The next day, I went to another hospital and they found I also fractured my clavicle. The costs for this accident were extensive because hospital visits lasted 2 years, spanning 2 hospitals and an orthopedic clinic. But there were no surgeries, and everything was paid by the driver's insurance. There's no need to worry about costs in Japan. I also broke my foot. I broke a metatarsal in my foot when I rolled my ankle. After x-rays, a temporary stabilizing cast, and doctor consultation, the cost was 6,000 yen total. That's it, all done. We drove off the road and sailed down this ravine. Can you guess my injuries? I had a seatbelt on, but that also caused my injuries. It was an ambulance ride, CT scan, x-rays for broken ribs, thumb, my neck, and a brace for my torso to stabilize my broken ribs. Everything for this car accident was 12,700 yen, and they gave me a CD with all my imaging results. Now I'll talk about wait times for all my hospital visits. Ski accident shoulder surgery, basically no wait. I only had to wait 3 or 4 days for the surgery, but I opted for 1 week later to fit my schedule. Bike accident number 1, this was an ER visit, no wait. Bike accident number 2, an ER visit, no wait. Broken foot. Wait time was 20 minutes before my foot was set in a cast and I was done. Car accident, broken ribs, this was an ER visit, no wait. Now I'll talk about the quality of service, which has been mixed. For the ski accident, the orthopedic surgeon for my shoulder surgery was great. He found lots of minute problems in different areas of my shoulder, and he explained everything clearly and answered all my questions. His effort was genuine, and after the surgery, my range of motion was not returning, so he even offered to do a follow-up surgery to release my shoulder even more. He offered this second surgery for free. I score this experience a 9. Bike accident number 1. Service was emergency room only. The doctor found my fractured ribs with x-rays. These were hairline fractures, which requires some commitment from the doctors to search for, but also a willingness to even try. I score this experience an 8. Bike accident number 2. The first ER doctor I saw after the ambulance ride was good. He found an old injury from 20 years before, and it was very hard to recognize. A subtle anterior wedging and compression at my thoracic 8 vertebrae. He also found broken ribs, but he did not find my broken clavicle. I score this experience a 7. But for this same accident, I went to 2 hospitals and an orthopedic clinic. The second hospital found my broken clavicle. But the very young doctor was making stupid video game sounds. Yosh. As he worked through his checklist with me. Yosh. It was very unprofessional. Then it got worse as I went higher up. Yosh! The head of the orthopedic department was being difficult about writing the correct notes in his medical record, which I had forced him to do. He also attempted to lie and say his hospital doesn't give paperwork for anything, no records, nothing. After I finished with him, I walked over to the records office and they said I can get everything I want for 5,000 yen. The head of orthopedics lied. I scored this experience a 1. But a year later, at the same hospital, in a different department, neurology, another doctor was great. He was a neurologist making a complicated diagnosis. He was professional and he filled out lots of cumbersome paperwork for me to qualify for a permanent disability. I scored this second experience at this hospital an 8. My broken foot. An orthopedist for my broken foot was terrible. At a small clinic offering emergency services at a popular train station on a Saturday night though. He was flying through patients. I sat down and told him my problem. We went to the next room and did my x-rays in about 2 minutes. We were flying. Back to his office, he told me I had broken a metatarsal. 3 minutes total had passed. Without explaining the next step, he stood up and left the room. I stayed seated and forced him to return to tell me about my injury. After explaining, he ushered me out to a nurse. I walked over to a nurse. She had already heated the temporary cast and placed my foot in it without telling me what was happening. It was absurd. I needed to know the best position to hold my ankle in as the cast was cooling and setting with my foot in it. I already instinctively knew 90 degrees was the best angle, and I told this to the nurse. She agreed with me, but she never said anything to prepare me for the cast. I scored this experience a 2. Car accident. The ER doctor took a CT scan for broken ribs. He was only searching for compound or noticeable fractures. Later, I forced him to also take x-rays to actually see what's happening. My pain was obviously broken ribs, an injury I've had many times. I know exactly what this feels like. After the x-rays, he tried to say there were no fractures. Then I showed him the fracture line on the image he was showing me. I said, "Look, it's right there." What's worse, he was training a resident doctor who was observing. I got a chest band in the end to stabilize the broken ribs he said I didn't break. Then the resident put a bandage over my tibia, which had a long scrape on its edge. She tapped it with water. She did not clean it. I told her hydrogen peroxide. This visit was actually very positive. The doctor and the resident in training were very nice. They just did terrible work. I scored this experience a 3. In Japan, you need to go into the healthcare system with some basic knowledge of medicine and of your injury. If you don't, some doctors will treat you like a clueless idiot and push you out the door. You really have to advocate for yourself in Japan to get quality treatment. Many Japanese doctors default to the bare minimum. You must force them to level up if you want to get the best out of them, and that requires you guide them, slow them down, and push them. Overall, Japan's healthcare is light years better than America. If you think paying $1 to the government for healthcare is somehow more expensive than paying $3 to a private corporation, you are an idiot. There is a reason no universal healthcare has dropped their single-payer scheme and switched over to America's failed for-profit death care. And that reason is cost, but also efficacy in almost every metric of healthcare outcomes. As the rest of the world figured out, universal healthcare has better outcomes across the board for much cheaper prices. I recently listened to Canadian doctor Peter Attia's podcast on American healthcare. It was a waste of time and I didn't finish it. He never discussed the many failed metrics of American healthcare. Nothing about cost or quality for others. But he was quick to criticize Canada based on a surgery wait time horror story passed around for decades. Don't believe misleading portrayals of superior universal healthcare. I have Japanese friends living in America. They have insurance in Japan and America. They wait to go back to Japan to get medical procedures. That's all you need to know. Thanks for watching.